The CDC is updating its isolation recommendations after facing criticism over a recent change. The agency has now announced a new stance on testing. Meanwhile, President Biden made a public plea yesterday urging Americans to get vaccinated as new infections skyrocket. Weijia Jiang reports.
The CDC is standing by its guidance that those who are infected with COVID-19 can stop isolating after 5 days if they are asymptomatic or feeling mildly ill, and those people are still not required to get a negative test result first. However, the CDC added a caveat. If someone has access to a test and wants to take it, they may. And those who test positive should isolate for another 5 days. The CDC is also encouraging people coming out of isolation to continue to wear masks for an additional 5 days. Last week, when it scaled back the isolation period from 10 to 5 days, many outside health experts worried that was too soon to ensure the patient is no longer contagious without a test. Yesterday, the CDC posted new data that shows most transmission happens early in the infection. This all comes, of course, as the U.S. is seeing a nationwide shortage of those at-home test kits. The federal government is launching a website this month for people to order a test to be shipped to them for free. President Biden also announced that he would double the order of Pfizer's antiviral pill from 10 million to 20 million, with the first half expected to be available by June. Vlad and Anne-Marie.
All right, Weijia, thank you very much. For more on this, let's bring in John Moore. He's a professor of microbiology and immunology at Weill Cornell Medical College. So, doctor, what are your thoughts on the CDC's isolation recommendation?
Well, I printed out a 6-page document this morning, and I haven't had time to digest it. It's horribly complicated. It seems to me a TMI document. They're doing their best. I mean, it is a difficult situation, and one doesn't like to be critical of the CDC, but I don't think the average member of the public is going to get a hold of this document, read 6 pages of it, try and figure out what subclause applies to them and not to someone else, and do the right thing. I mean, this 5-day recommendation, you understand why it's done, because it's important for people in essential occupations to be able to work efficiently and enough of them. But it's pretty controversial, and a lot of healthcare workers I know, friends who are on the front lines, are very reluctant to see this happening in their own professions, or to see people turning up in the emergency room who've been infected as a result of returning to work too early. I mean, it's a mess. We are in a mess with Omicron, and there is no simple answer to this. A lot of the recommendations put people on trust. It's an honor system. Are you feeling okay? Do you think you're recovered? Well, these are not easy situations to navigate, I'm afraid. I don't have any simple answers.
You just nailed what I was thinking. I thought, you know what, the irony of you saying that you have this document to go through with all this stuff in it, and then the messaging, the public messaging that comes to us is so simple. After 5 days, if you feel okay, put a mask on and get on out there. And I thought, if you feel okay, that's not how it usually works. You know, somebody says to me, are you getting over a cold? Are you feeling better? I go, I'm 80%. I'm 85%. I still have this one symptom. I don't know if I would be able, after 5 days, to accurately gauge whether or not I was out of the woods and no longer a risk. And then there's this other thing now. And I think, you know, I understand that the CDC is getting new information all the time, but I think every time something changes a little, people, you know, kind of lose a little faith. So the CDC has approved a revised time frame between the second and third Pfizer doses from 6 to 5 months. Do you think this decision will help the current surge that we're seeing?
Well, it doesn't have an immediate effect, but it's okay. That decision has support among immunologists. The period between the second and third doses is important to increase the quality of your immune response to the vaccination, which again is important for dealing with variants like Omicron. Now, that period, it takes time for this period between the second and third doses. And 6 months was okay. 5 months is okay. I wouldn't like to see it go down to 3 months. I think that would be too short. So I don't think people in my world have a problem with changing it to 5 months from 6, but that's not going to have a big immediate impact. I mean, we're dealing with Omicron now, and only a small number of Americans are going to be pushed forward in time from 6 months to 5 months. So yeah, it's a good recommendation, but it's not the most important thing on our agendas right now.
So, Doctor, you and Anne-Marie sort of mentioned a couple of things that I think sort of needs unbundling. Understanding, of course, as Anne-Marie said, that the nature of the threat changes, and thus the nature of how our public health officials respond to the threat also evolves and changes. I think a lot of people understand that. But again, you just pointed out how confusing it seems with all this paperwork that you've received. I listened to Dr. Celine Gounder on CBS Mornings earlier today, who was on President Biden-elect's and the President-elect's COVID-19 advisory board before he took office, suggests that also she's confused by some of the recommendations that the CDC is now putting out. So throughout the course of this pandemic, as public health officials, the President of the United States, reporters and journalists have reported back to the people that these are the things that we need to do. Now things are changing, and it does give people, a lack of confidence in now our public health officials, and it also gives people who have said all along that the American public should not put their trust in some of these public health officials because of a variety of reasons, some of which are coming to light now, does give people pause. And now you've got people that are struggling to get their hands on tests. Here in the United States of America, the president is saying that he's going to provide these tests, but people can't get their hands on them. I mean, how is that affecting our pandemic response?
Well, if Celine's feeling confused, that makes me feel better because she's amazing. Look, it's difficult to be critical of people in the public health world because they really are trying to do their best in a very complicated situation. And I don't think any of us out here who are just talking heads on TV programs, I don't think we could do much better. Omicron came out of essentially nowhere less than a month ago. It's incredibly infectious. It's infected 1 million Americans, reported infected on Monday. There's 500,000 cases a day. It is definitely a more transmissible and subtly different virus than we've been used to. And everyone's scrambling for information. It takes time to fully understand what's going on. I mean, everyone wants instant answers, but you don't get them. I mean, there's still major information on Omicron that we're lacking. Why is it so incredibly infectious? Is it more transmissible by breathing rather than sneezing? What is the incubation period? What's the profile of virus production in the nose and throat? We don't have that information. So people are legitimately making honest best guesses. And yeah, the messaging could be better. I mean, a 6-page document could be boiled down to a few bullet points perhaps, but I don't think any of us could do any better in this really complicated and ever-changing situation. And a lot of it is based on people behaving sensibly. I mean, firstly, be fully vaccinated. Secondly, if you think you're infected, don't take a risk with your colleagues. I mean, bias your decisions towards protecting yourself and your colleagues and your friends and your family from getting infected themselves. But, the good news about Omicron is it definitely causes only milder infections. It is not as lethal as Delta, which is still around. We shan't forget Delta. Delta is still the dangerous variant. It's just less of it compared to Omicron. So we have to, be on our guard and try to not get into situations where we're exposing ourselves to a virus that you're very likely to get, much more so than in previous winters.
John Moore, you've given us some clarity, and I don't know, you said, it makes you feel good that perhaps that she's just as confused as you. It makes me feel worse because I'm depending on the experts to give me some sort of clarity. And you did, you certainly did. Thank you so much.
You're welcome.